Sugammadex is listed as an essential drug. Anesthetists use it routinely at the end of an operation to reverse neuromuscular blockade, ensuring a patient's muscles return to full strength. Sugammadex selectively encapsulates rocuronium molecules, pulling them from nerve receptors to restore muscle function. But notice the bloodstream. Sugammadex also competitively binds to exogenous progesterone. This off-target mechanism sequesters the hormone, causing a sudden drop in circulating progesterone levels. For women taking oral hormonal contraceptives, like the mini pill, this sudden drop in progesterone temporarily neutralizes the effectiveness of their birth control. Because of this interaction, the post-operative protocol is strict. Patients are instructed to treat the Sugammadex dose exactly as if they had missed an oral contraceptive pill. Clinical guidelines mandate that the patient use an additional, non-hormonal method of contraception for a full 7 days post-surgery.
Welcome to The Explainer. Okay, I am absolutely thrilled you're here today because we have a truly fascinating medical mystery to unpack. We are going to look into a widely used surgical drug that performs an absolute miracle in the operating room, but holds a completely hidden, invisible surprise for millions of patients. Let's dive right into this.
It sounds like the plot of a daytime soap opera, right? I mean, could waking up from a totally routine surgery actually lead to an unplanned pregnancy? Well, if you use hormonal birth control, the medical literature says, yes, it absolutely can. And it all comes down to a really specific drug interaction happening quietly in your bloodstream while you are completely asleep.
So here's our roadmap for today's Explainer. We'll cover waking up from anesthesia, the contraceptive plot twist, how the interaction actually works, the 7-day rule, and finally, bridging the communication gap. Let's get into it.
Part 1, waking up from anesthesia and the miracle of reversal. So, during major surgery, you're often given muscle relaxants, and those have to be reversed before you can wake up and breathe on your own again. Modern medicine is amazing at this. The data paints such a clear picture here. There's this modern reversal drug called Sugammadex, and it can completely reverse muscle paralysis in a median time of just 1.4 minutes. I mean, 1.4 minutes! Compare that to the older drug, neostigmine, which took a really sluggish 21.5 minutes. Sugammadex is an absolute game changer. It gets patients breathing safely on their own almost immediately. But, and you probably knew there was a but coming, this incredible speed comes with a very specific, kinda invisible catch.
Which brings us to part 2, the contraceptive plot twist, and an invisible side effect.
This miracle drug does exactly what it's supposed to do, but it inadvertently does something else too. The pharmacological data highlights something wild. A standard dose of Sugammadex is predicted to decrease progesterone exposure by 34%. Now, why does that matter? Well, progesterone is the absolute key hormone in most birth control methods. So when you get this drug, your circulating progesterone levels just plummet. To put that into real-world clinical context, getting a standard dose of this reversal drug at the end of your surgery is the exact biological equivalent of completely missing your daily birth control pill or taking it 12 hours too late. Literally, your safety net just suddenly drops.
Section 3. How the interaction works. The molecular sponge.
Okay, Sugammadex is an incredible piece of molecular engineering. It essentially acts like a microscopic sponge. Step 1, it enters your bloodstream. Step 2, it actively seeks out those muscle relaxant molecules, traps them inside its core, and then safely floats them right out of your body through your kidneys. It's brilliant. But here's the kicker in step 3, Sugammadex isn't perfectly picky. Binding studies show it actually has a really strong chemical affinity for progesterone too. So as it's sweeping through your blood to grab those anesthesia drugs, it accidentally encapsulates your birth control hormones right alongside them. It's just sweeping them right out of your system.
And you might be thinking this just affects the daily pill. Nope. Guidelines from groups like the New Zealand Society of Anesthetists and the NHS show a massive list of affected methods. It impacts the combined pill and the mini pill, for sure, but it also affects those long-acting methods that people so often just set and forget. We are talking about arm implants like Implanon, hormonal IUDs like Mirena and Kylena, injections like Depo-Provera, patches, vaginal rings, the whole shebang. If your contraception relies on hormones, Sugammadex basically hits a temporary reset button on your protection.
Section 4, the 7-day rule. Guidelines for patients. So what exactly are patients supposed to do about this to stay safe? Well, medical institutions haven't ignored this. They've developed very specific protocols. There are actual official patient advisory leaflets out there, like the ones used at St. George's Hospital in the UK, proving this isn't just some theoretical science experiment. This is a very real, active part of postoperative care. They've mapped out exactly what you need to do the moment you wake up and head home.
Let's actually break down those instructions, because they split into two different paths. If you're on an oral contraceptive, the pill, you essentially need to treat your surgery day as if you completely missed a pill. You have to open your packet, read those standard missed pill instructions, and follow them to the letter. But if you're on a non-oral contraceptive, so an IUD, an implant, a patch, the FDA and major medical bodies advise that you absolutely must use a backup barrier method, like condoms, for exactly 7 days following the surgery. You need that full week to let your hormone levels stabilize and fully reestablish your protection.
Now, I want to add a bit of clinical nuance here, just to be completely balanced. Some recent retrospective studies have looked at large databases and honestly found very few documented cases of post-operative pregnancies. Because of that, some researchers are kind of debating whether this theoretical drop in progesterone always causes a clinically significant risk of actually ovulating. But, and this is a big but, because the risk of an unwanted pregnancy is so incredibly high stakes, organizations like the FDA and hospitals globally strictly maintain that 7-day backup rule. When it comes to patient safety, the medical community is going to prioritize maximum caution every single time.
Which brings us to Section 5, bridging the communication gap and the hidden danger. So the guidelines are crystal clear, right? Well, there's a huge hidden danger in everyday practice. Check out this number, 0.7%. According to a recent study in the Journal of Anesthesia, out of all the women using hormonal contraception at the time they were exposed to Sugammadex, only 0.7% had documented counseling about this drug interaction. That means 99.3% of patients woke up, went home, and went about their daily lives with absolutely no idea that their birth control might be temporarily compromised. That is wild.
The data reveals this massive, frankly shocking disconnect. Anesthesia providers are highly educated professionals, and the numbers show that most of them absolutely know about the risk this drug poses to the oral pill. A smaller, but still pretty significant chunk know it also affects IUDs and implants. But when you look at actual fast-paced clinical practice, they report rarely engaging in this discussion with their patients. There is just this huge gap between what the medical providers know in their heads and what patients are actually being told in the recovery room. To try and fix this, safety organizations and hospitals are really pushing for standardized communication. There's this recommended template from Tufts Medical Center, and it's great because it's simple, it's direct, and it leaves zero room for confusion. It basically says you've been given a drug called Sugammadex. It can interfere with progestin-based birth control. To prevent unintended pregnancy, you should use a backup method for 1 week. Having this printed out and literally handed to patients when they're discharged, or just baked right into their post-op paperwork, empowers the patient to protect themselves, even if the surgical team totally forgets to mention it out loud.
Which leaves us with this really profound question to think about. Should a drug's invisible side effect fundamentally change how we view informed consent? I mean, Sugammadex is incredibly safe. It's highly effective. It literally revolutionized anesthesia. But it highlights such a crucial lesson. Our bodies are these complex, deeply interconnected systems. Anesthesia isn't just about going to sleep. It's about pharmacology that interacts with literally everything else in your life. So the next time you or someone you love goes in for surgery, keep this explainer in mind. Be your own advocate. Tell your anesthesiologist exactly what medications you're on, including that IUD or implant, and always, always ask, will anything you give me today affect my other medications? Thank you so much for joining me for this deep dive today. Keep asking questions, keep learning, and I'll see you in the next explainer.